On behalf of the Rabbinical Alliance of America, Igud HaRabbanim, the National Council of Young Israel, and Lenox Hill Hospital, I want to welcome you to this premier symposium, Mechayel L'Chayel, Living a Healthier Life, Physically, Mentally, and Spiritually, being held May 28, 2019, Chav Gimel Ir Tavshin Ayin Tav, at Lenox Hill, one of the most renowned hospitals in the United States. We are truly honored to have in the audience many distinguished rabbis, chaplains, and other professionals. It is now my honor and pleasure to introduce to you Rabbi Simcha Silverman, the Director of Chaplaincy Services of Lenox Hill Hospital, who is also the Rabbi of Congregation Eitz Chaim of Flatbush.
How beautiful and appropriate that Lenox Hill Hospital is hosting this symposium, a joint symposium of two wonderful rabbinic organizations, Rabbinical Alliance of America and the National Council of Young Israel, coming together to this evening. How beautiful it is that a hospital that caters so wonderfully to the needs of the Jewish community is able to host the rabbis representing so many communities. I'll take a moment and give you a walkthrough of what it means to cater to, accommodate, meet the needs of the Jewish community. You start from the lobby, and perhaps you notice when you walk in, if you came in through the main lobby, that there's a sign that's there, or it goes up closer towards the end of the week, that if you're Sabbath observant, notify security, because we have provisions beginning in the main lobby for Sabbath observers. There's kosher catered food for our patients, and in fact, the person who's catering tonight's dinner refreshments is the same caterer that provides the kosher food for our patients. We're not serving you hospital food, we're serving our patients catered food. There's a Sabbath elevator, in effect from Friday 4 p.m. through Saturday 8 p.m. to help people get up and down. There's a bigger cholim room that's really an oasis for so many people that come in inpatients or appointments, and we're happy to have the founder of the bigger cholim room, Mr. Mendy Greenberger, here with us this evening. There are Shabbos apartments for those that need to stay by the hospital and accommodations made for the Sabbath. There's Abraham Steinberg, who many of us know. If you don't yet know, we'll make sure you get to know. But most of those things that I just mentioned are reasons why a person would pick a hotel or a place to vacation, not necessarily a hospital. What's more important is the sensitivity to the needs and the desires of medical care according to Jewish law and tradition. And that's something where Lenox Hill is a premier institution in making sure that the needs of the patients and their families' requests are tailor-made and custom to Jewish law and tradition when the need calls for it. It's not uncommon to be sitting in a meeting in this hospital and to hear the names of rabbis or organizations of people sitting in this room right now being mentioned as part of the care plan for the patient, where a doctor may mention that they spoke to a rabbi representing an organization that can help guide Jewish law and tradition when it comes to medical decisions. That doesn't happen by itself. It comes because there's an administration in this hospital that supports the needs, the cultural needs, the specific needs of each community that we cater to. Well, Mr. Leggio is a driving force behind care that's culturally sensitive, culturally tailored, behind community relationships, behind building community, behind being a wellness partner with the communities that we offer and serve. And tonight it's an honor to have Mr. Joe Leggio with us, to be with us at this event. So thank you, Mr. Leggio. The doctors that are participating, they express our great appreciation. Dr. Mendel, his enthusiasm for this event, his wisdom, his knowledge, and his area of expertise. The other physicians that will be here later as their presentations come up, but excellent, wonderful physicians, and the opportunity to engage with them tonight. I know Dr. Mendel wants to look at it more as a conversation than a presentation, and we thank him for his engagement and commitment to tonight's event, so thank you. Again, it's my honor to welcome you to Lenox Hill Hospital, and thank you so much for being with us this evening. Now please join me in welcoming Mr. Joe Leggio for executive remarks.
My name is Joe Leggio. As Simcha said, I'm one of the associate executive directors here. These are some of my favorite moments that we have. When we get to connect, when we get to talk to people of this community, of surrounding communities, of neighboring communities, and we get to take care of one another. And that's what this hospital does. The hospital is a place where we take care of people. And I kind of think of this room as a room full of caretakers of your community, of your families, of your friends, of your spaces. And so how important that we care for you. So we're honored to have everyone here today. We're excited this evening. I know all the speakers, we are in for good conversations, some good advice, some good questions.
There's no such thing as vacation for the rabbinate. A rabbi, no matter where he goes, is constantly on patrol, constantly ministering for the people. And if you cannot minister to yourself, you cannot say this quiet time, I'm shutting the cell phone. Of course there'll be a crisis, people can't find me. By Balabatim, when the rabbi goes on the bima, he has to smile. When he talks to the children in the Talmud Torah, the Hebrew school, he has to smile. When he meets politicians, he definitely has to smile. When he interacts with the old and the young, he has to smile. But the world is never forgiving. By a rabbi, you look with a fine lens to catch him on something. So not only must you be a Byzantine doll, 24/7, 365 days a year, you gentlemen are in cotton scrutiny. So tonight's program, not only the mental health, not to be burnt out for spiritual care as Rabbanim, is also meant to help you under the extra stress of what Rabbanim go through because of Balabatim.
You're all in a field that you put your heart before everything else. Tonight I ask you to understand that all we want of you is to be able to, you have the strength to be able to do this to 120 years. Let's learn something tonight. Let's really listen and thank the presenters for giving it their all.
My name is Rabbi Michal Chazan, and I'm a member of the Rabbinical Alliance of America Chaplaincy Commission. I'm also a graduate from the Young Israel National Council Advanced Rabbinics course, which Rabbi Hammer helped me tremendously. It's my pleasure to introduce Dr. Stephen Mendel.
About a month ago, there was a patient here in the hospital, an African-American woman, who was admitted with cancer. And she was very despondent. And she read the Bible and felt as though maybe there's no hope. And she would cry each morning thinking whether she was going to live or whether she was going to die. And she said she was a very religious person and wasn't sure whether she still believed, even though she read the Bible every day. So what did I do? I called in Abe Steinberg. And Abe Steinberg went to see her every day she was in the hospital. And 5 days later, when she left and responded to her chemotherapy, she said to me, he gave me resilience, he gave me hope. I now can face my family with courage, and thank you for sending me my reply. So that's what we do at Lenox Hill. So you know, there are a lot of things. We're going to go over this, but the little saying which you know better than me, if I'm not for myself, who will be for me? So a rabbi came to see me about a week ago. He came to see me with migraine. He had hypertension, diabetes, overweight. He was a non-smoker. He didn't exercise and didn't take a vacation in many years. He told me he didn't miss a sermon for 15 years on any Shabbos. I took time to listen, and he said to me he was feeling overwhelmed. Why? Because he said, everybody is seeking my advice. They want me to comfort them on divorce, mental health challenges, family members, conflicts, financial instability, substance abuse, domestic violence, and housing concerns. The rabbi said, I feel stressed. I feel all these problems, but I don't feel I have the expertise to handle it. We ruled out any medical causes, and we sat down for a long time and talked to him about life-changing strategies. We told him that he should sleep better, better nutrition, plan vacations with his family, exercise, support from his colleagues, get support from Jewish services. And he called me over the weekend, and he told me, I feel like I'm renewed. I feel I can now do what I can, but I'm going on a sabbatical for 3 months. So over the past couple of weeks, when I spoke to Rabbi Silverman and the group, they suggested that I suggested to them I can tell them about stroke and brain tumors and all the fabulous programs we have. We have epilepsy programs, movement disorder programs, stroke programs, dementia programs. We have all the programs here. And Rabbi Silverman says, no, we want to hear a little about self-care. We want to hear, so what did I do? Not knowing a little much about self-care, decided I was going to make calls. So I called up the director of Chabad. I spoke to the Lubavitch Rebbe. I talked to an imam. I talked to a priest. And they all had the same feeling. They said to me, we have the following principles. Number one, we need to watch over our own body. I need, as the rabbi said, cut off my cell phone at night. Number two, I can only take care of you if I could take care of myself. Every therapist and every rabbi needs a therapist. It's okay to say, I don't know, and we're all human. And ask the experts. There's a stigma that we want to erase because we're all human, we all have families, and we all have stresses in our lives, and we'll talk a little about today how we could reduce those stresses. Just apropos, within the past 7 days, the World Health Organization has adopted guidelines for a healthy lifestyle to reduce dementia. And we're going to go over each of those guidelines. If we talk about drugs that we can take for dementia, none of them work. There are multiple trials of various drugs, but to date, 95% of all those drugs have been ineffective. What can we do? The questions are, last week I went to a conference at the Spanish-Portuguese synagogue on depression and suicide among the Jewish population. People raised their hands and said, I went to a psychiatrist, I went to a psychologist. They all told me that my son was okay. So then I went to another psychologist, and the following week he jumped out of the window. So the answer is, so what could we do? Sometimes we can't prevent these things, but you here can provide comfort and support so these families could survive, reduce the stigma. When people have illnesses, it's not their own individual illness, it's a family illness. Many times it's a brain disease, whether it's mental illness, whether it's a heart disease, it's still a family disease that the families have to cope. So let's look at some of the things that we have here. I'll go next, I'll do this, okay? So neurons have the ability to function and survive depending upon a couple of things. The reactions that take place that support survival, but also has to function for repair, remodeling and regeneration. So if you remember, Kathy Gifford and other people who were shot in the head, they were felt they can't speak anymore. But the brain has some plasticity, and therefore, whether it's plasticity for the body, it's also plasticity for the mind and spirit. Neurons that constantly have to maintain and repair themselves. Okay? So how do we eat well? What do we do? What do we do? So even if you're healthy, there are changes in memory. And with age, we're multitasking. We have difficulty finding words. We have some reduced ability to pay attention, but we could still improve our skills. We could learn new things. We could create new memories, improve our vocabulary. And each one of us, the question is, when do we seek help? When is it where in our lives that is something that's a little different? Are we saying there's different, or families? So most families who come to see me do not feel they have any problem at all. It's their caregivers that feel they have a problem, and their caregivers are the ones who are frequently suffering. Okay? How do we protect ourselves? We're going to talk a little about healthy eating, Mediterranean diet, regular exercise, keep your brain active, have social connections, and get enough sleep. And clearly not enough sleep or too much sleep has been shown to increase the probability of dementia. Okay? Healthy eating, good nutrition. So eating less sugar, salt, solid fat, and it's not when you're 70 years old, but when you're 30 years old, or when you're 40 years old. Because once you develop a problem earlier in life, it's going to lead to a problem later on, and it's something that you may not be able to control. You should get regular medical checkups, and you should follow a diet. There are various diets that people have used that the nutritionist who will speak with you, and they may be helpful. They may be helpful. They may be helpful to reduce your cholesterol. They may be helpful to reduce obesity. Reducing obesity will lead to better cognition. There are many patients that I've seen who have had gastric bypass surgery, and following the gastric bypass surgery, they felt they're thinking better. Whether long-term it will be of benefit, unclear. But these are patients that I see on a regular basis who are markedly obese. Only 20% after 2 years have even maintained a loss of weight. Exercise. So I have something which I found from Rabbi Hillel the Elder. Some students talked to Rabbi Hillel, and when he took his students for a walk with them, the students asked the rabbi, "Why are you walking?" He says, "To do a mitzvah." What's a mitzvah? To take a bath in the clubhouse. He said, Rabbi, he describes the importance of physical body. His logic, he said, extends not only to mental, but emotional health. He said, I'm trying to pursue practices that don't drain me and restore my body and mind. Balancing work and literature and lifestyle. Demonstrating the power of disengaging, taking time off. So, healthy lifestyle. Take a walk. Take a break during the day. Help prevent falls. Falls are a major issue. People who fall down and get hurt, especially when they may have strokes or other diseases, have a much higher morbidity and mortality. Okay? Keeping your mind active, reading books and magazines and taking a class. One rabbi told me that he learned a new language. He learned Chinese. Why did he learn Chinese? Because he felt he wanted to do something new. And he plays video games. He says, I don't tell anybody that I play video games, but I play video games because it keeps my body much more active. And I play video games every night, and I play it with my children. And I'm there with my children, and my wife looks at me and says, Rabbi, what are you doing? And he says, I'm talking and I'm playing with my children every night. So let me just stop for a moment and ask thoughts, comments. Yes?
At the previous slide, when you discussed exercise,
Yes.
are you talking about intense exercise or just physical activity like walking, taking a long walk?
I think the way I look at it, I tell my patients, there's chicken and there's humans. This is what I explain to them. Chicken, there's dark meat and there's light meat. In humans, it's all like a checkerboard. So if you're running and doing aerobic activity, that may not be good enough because you need to do some resistance. Not to say you need to go to the gym, but you need to exercise your entire body. We did a study that looked at people who were kidney transplant people, and we exercised them for 5 days and wanted to look at their hemoglobin A1C, and it didn't change. Then we had them do weights 2 days a week. It didn't change. And now we combined 2 days here and 2 days there, and they had a dramatic drop. So it's a combination of both, and what you feel comfortable to do, obviously with your physician sort of guiding you, and not sort of going to the gym where we'll all get hurt if we go the first time, but at the same time it's a matter of developing a program for your body. The question is, and I would ask you in all respect, is when you do a sermon in the service, how comfortable do you feel to talk about addiction, which is in the community? How comfortable do you feel to talk about mental illness? That you feel about that someone who is might be disabled, that person may be the same under God. So we had a program in one of my synagogues where children who couldn't speak, they could not speak at all, and they were autistic, and we made sure they had a bar mitzvah, because all they had to say was Baruch. And 1,000 people showed up for one of those meetings, and they were felt equal under God. There's no difference between them. So, you know, it's little things that you can do. We also did, last thing I'll tell you, is in our synagogue, which is now a conservative synagogue, although I told Rabbi Silverman I went to 7 years of Chassan Sofa. I did that. In our, well, I'll send it to you, okay? So in our synagogue, there's two things. The rabbi says, sometimes people don't know, please stand. So on the Upper East Side, here, There's no rabbi who ever says, please stand, and he says, for those who are able, please stand. And many of the people now say, who are in walkers, say, I feel like a whole person. And second, what we did is we put up a second mezuzah. Now, whether that's a good idea or a bad idea, so for those who couldn't reach, we had a second mezuzah, so those who can reach the mezuzah. And without any fanfare, but just doing little tiny things. On Shavuos, we're having a service of sensitivity.
And I had a story 2 weeks ago. I got called by someone on Saturday night that Saturday morning someone came to synagogue and they ended up not being able to talk. Right side became weak, and they called Hatzalah and they got taken to the hospital, and they actually had a big clot in their brain, blocking up the blood vessel in their brain, and they were able to do a procedure, and the guy was discharged 3 days later to rehab, and he's actually talking and he's moving, and I think he's going to do really well. But what was important was the people who were there recognized that he was having a stroke. And the main things that are there, I have some cards that people can take, and there's something called the Be Fast, which is something that the EMS and Hatzalah are using, and it's something that we do have some slides that we can give you if you want to put up in shul or you want anything. The B stands for balance. If someone walks in and they have imbalance that seems out of proportion to something that's going on, their eyes, if someone's having double vision, that sustained, facial droop, if they have arm weakness, leg weakness, especially the same side, like the right side arm and leg, slurred speech, but even more problems getting words out, problems. You see they're having real problems. These are all major pieces, and the T is time, because there's a clot buster medication which we can give up to about 4 hours, 4.5 hours, and then the window opens up to about a day. It's now 24 hours, and that is to get that clot out if there's a clot. So it's important that if someone notices it, that they call and they go. And Hatzalah will take the patient to the closest hospital that has the facilities to take care of you. So if the patient has anything, it's really important to call. We have everything here. I mean, from my point of view, I always tell my patients, you call, you get taken to the closest hospital. I can always transfer you here. I transfer a lot of patients in here all the time.
So really, if we're trying to eat healthy and balance our calories, whether that's maybe watching our weight, or I think your previous speaker spoke about high cholesterol, high blood pressure, or diabetes, really watching foods that are used with this description you might want to be mindful of, versus choosing things that obviously are inclusive of more vegetables and fruits. The only one caveat here is that bedtime snacking can be on a slippery slope.
It is my distinct pleasure and honor to introduce Dr. Adam Rosenbluth, cardiologist at Lennox Hill Hospital.
I'm a cardiologist, but I have the true honor and blessing of having taken over an internal medicine practice, my father and my grandfather. So I'm the third generation in the office, so I carried on their tradition of internal medicine, and I added to that cardiology. That the holidays are no excuse for taking a disease like diabetes not seriously. And that is certainly true of everybody. I think it's, if this room were 90 degrees and then 60 degrees, and then 90 degrees and then 60 degrees, and you guys complain to me, Adam, it's hot, it's cold, it's hot, it's cold. I say, but the average is 75, that's not bad. You say, but it's never 75, it's either 90 or it's 60. The body's the same way. Our bodies like homeostasis. They like that blood sugar to be relatively well controlled all the time. The idea that it's fine to go up for a few months and then down for a few months and then back up for a few months is not healthy for us. In fact, I will show you with a couple of slides tonight that particularly when it comes to diabetes and the heart, as you start to accrue events, you end up in a downward spiral. So your body never forgets the last event that you had. So if you get out of control and have one event, and you say, well, I'll get back into control, you will never get back to the level that you were at. So if you have another event, you're only going to drop lower and lower and lower. So this idea that Dr. Lubin and Dr. Mendel and I talk about, keep your blood pressure controlled all the time. Keep your cholesterol controlled all the time. Keep your diabetes controlled all the time. Means that we should be talking to people about a healthier way of living, a way of life, not something where they're punishing themselves here and then rewarding themselves there. We have to really take those words out and think about this more as a healthy way of living. So when it comes to diabetes, as I said, this is groundbreaking data that we have learned. It is so powerful that despite the fact that we do not understand how these two new classes of medicines are working to reduce cardiovascular disease, the American Heart Association, the American College of Cardiology have already endorsed them into our algorithms of care. We call our guidelines. There was a large trial that was just released last summer, and it was already adapted into the guidelines. Why? Because the American Heart Association, the American College of Cardiology went over the data and said, we can't stop this. This is too important for us to think to not take into account. And as you know, guidelines are what change practice. So there can be a lot of good articles out there, but if everyone doesn't read them and adapt them, nothing happens. But when those articles and that research translate into guidelines, people start to follow them and care starts to change. So as we go through these slides, hopefully we can restart this later. Again, they're more of a guide to you, but I think you'll find some of the information interesting. If we can make the slides change, it'll be interesting. There we go. So, what's going on with type 2 diabetes now? Well, 60% of teenagers in the United States are overweight. We are now diagnosing type 2 diabetes in teenagers. We used to think about type 2 diabetes as being an older adult, 50, 60, 70, 80, you start to get type 2. If you had diabetes when you were a teenager, you must have type 1. But in fact, that's now changed because of the way we eat. It was so poignant to have that nutritionist up here because the way we eat has directly contributed to obesity in our society, and the obesity is what's driving things like blood pressure, cholesterol, diabetes, keeping Dr. Lubin and Dr. Mandel in business, unfortunately. So it's a widespread disease associated with multiple cardiovascular outcomes. That's what kind of makes diabetes cool. I know we're up here making it look like a bad disease, but from a cardiology standpoint, it's fascinating because it doesn't just give rise to one thing. Diabetics are at risk for peripheral vascular disease, people losing their toes, their feet, their lower legs. People with diabetes are at risk of stroke, heart attack, bypass, stent, congestive heart failure, and even what we call cardiovascular death. So currently, about 1 in 10 Americans has diabetes. That's enormous. Almost 90% of those patients are overweight or obese. The majority have a blood pressure that's above the recommended, and these are, I don't know if you followed, and I don't want to waste your time. Blood pressure recommendations have kind of bounced all over the place. Many of you will hear less than 120 over 80 is appropriate. You'll hear that, below 140 over 90 is appropriate. In the past, we wanted everybody below 140 over 90. We have now identified certain groups that we would like lower. Basically, we'd like everybody below 120 over 80, but we're not going to start therapy until they get above 140 over 90, unless they have a predisposing condition. Diabetes, we'd like below 130 over 80. So basically 140 over 90 still remains a cutoff for the diagnosis of high blood pressure. Almost half of what we call end-stage kidney disease, or dialysis, is related to diabetes. And about 50% of people with diabetes may develop heart failure, according to the American Diabetes Association. That bullet in the lower right-hand corner, I'm sure every speaker who's had the privilege of speaking with you guys today hopes that you'll remember one or two things. I hope that that lower right-hand corner is one of the things that you will remember. Heart failure is a terrible diagnosis for us to make. It has a 5-year 50% mortality. That's deadlier than most cancers that we diagnose. It's the leading cost center for Medicare in the United States. longest length of stay in a U.S. hospital, and the leading cause of hospitalization for people 65 and older in the United States. So when you hear about heart failure being a bad disease, say yes, okay, sure, we all know that. But then when you recognize that 50% of patients with diabetes may develop heart failure, now you start to put together a link that's important for you and me and for our community of diabetes leading to heart failure and what we can do to prevent that from happening. So my objectives, and again, I'm going to go through the slides relatively quickly because it's really about a consistent message, but I'll sort of reiterate it with the different slides. I'd like you to understand the scope and the impact of type 2 diabetes, focusing on the risk of heart failure. I'd like to provide an overview of heart failure and the risk factors for heart failure that are unique to diabetes. Discuss how to assess risk and improve diagnosis of heart failure in people with type 2 diabetes in the primary care setting. This is a good message for us to get out. And recognize that renal and cardiovascular disease are closely interconnected with type 2 diabetes. So, when we think about diabetes, it's an interesting disease. Again, I know everybody thinks when you say a disease, we should just call it a bad thing, but diabetes is fascinating because not only is it a process that damages multiple organs in the human body, it's one of the few conditions that you and I can actually work on to make our patients, our community, healthier. So if you see somebody starting to become a diabetic, or you see somebody, listen, you're overweight, I've noticed you're continuing to gain weight. Have you been screened for diabetes? Has your doctor, have you gone to the doctor? You should be screened every year for your diabetes. If you have been screened, are you aware of the risks that are associated with it? What do you mean? Diabetes affects the pump, so it affects the heart. It affects the plumbing, all the arteries in our body, and the filter, the kidneys. Multiple organ systems involved, all of which will continue only to get worse if diabetes is not treated, but can actually get better if we improve our diabetic control. So heart failure, atherosclerotic coronary vessel disease, and kidney disease. People with type 2 diabetes are at greater risk of developing heart failure and being hospitalized due to heart failure. It wouldn't be such a big deal except that the #1 predictor of death in heart failure is being hospitalized for heart failure. I don't know if you know this, but at hospitals, we are penalized if we diagnose somebody with heart failure, we admit them for heart failure, discharge them, and they come back within 30 days, we get in trouble. Why? You don't get in trouble if somebody gets diagnosed with diabetes and gets admitted and they come back, or pneumonia and come back. I have a guy upstairs with asthma, if I discharge him tomorrow and he comes back in a week, nobody's going to care. He might care, but nobody else is going to care. But I admit somebody with heart failure, discharge them, and they come back within 30 days, the hospital is actually dinged for that. They are penalized for that. And it's because it is a predictor, not only is it a huge cost center for our system, but it's a predictor of death. You may have people in your community say, oh yeah, I have heart failure. First question you ask is, have you ever been in the hospital for it? Kind of like asthma or emphysema. They say, no, I've been fine for years. That patient's doing great. But like asthma or emphysema, if somebody says, oh yeah, I was just in the emergency room 2 weeks ago, and a month before that, 3 months before that, then you know that that person is not well controlled. They need to go see their doctor and get their asthma or emphysema under control. It's the exact same thing with heart failure. Somebody says, oh, I was told I had that years ago, but everything's fine, that's great. But if you think about heart failure, what's interesting, the greatest drug that we have had in terms of a trial and getting good results, the greatest drug in the history of heart failure is a drug that recently, relatively recently came out. We have it available now. It's a drug called Entresto. You don't need to memorize that. What you need to know is that the reduction in morbidity and mortality associated with that drug, greatest drug in the history of heart failure. You think, oh, it must have been like a 75% reduction in morbidity and mortality. No. 60? No. 50? No. It was a 40% reduction in morbidity and mortality. Now, from a cardiology standpoint, that's amazing. But for somebody who's got heart failure to know that the best drug in the history of heart failure only reduced morbidity and mortality by 40% is a little disappointing. So the whole goal of heart failure is to prevent it from happening in the first place.
difference of opinion amongst Rishonim and Achronim as to whether it's appropriate or inappropriate to interpret certain mitzvos in the Torah as having a component of promoting health and well-being. There is a major group of Rishonim who feel that a secondary aspect of many mitzvos in the Torah were designed to promote health and well-being. And there's a group that opposes that approach, and that's not at all what it's about. One of them doesn't believe that God exists, then all the 613 mitzvahs fall apart. So he says that's the Rambam's opinion as well, that the requirement to protect one's health is so fundamental that it's not a specific mitzvah, it's a prerequisite to the entirety of Torah, to the entirety of Judaism, to the entirety of any being practiced. That's why the opinion that Dr. Abraham quotes from Shlomo Zalman Aruch is more difficult for me to understand, because of the fact that it's so fundamental that according to Rambam it's not even a mitzvah. It's so absolute. It's like emunah in Hashem to take care of one's health.
I have 24 years in the department. I have a little over 2 years in hate crimes. Before that, I did 5 years in Special Victims Division, which was the overhead command of hate crimes, doing sex abuse and child abuse work citywide with that. So that's why they found me to be the fit to move to hate crimes. I could talk about numbers. I have all my numbers with me. Please, if you have any questions, jump right in. I'd rather a conversation than just listen to me speak. I can do the numbers, but you all read the newspaper, right? Are hate crimes up? Yes, they are. We know that. Are hate crimes against the Jewish community up? Yes, they are. We know that. A large majority, I think last year, a majority, last year about 52 to 54% of all hate crimes in the city were against Jewish people. If you break it down to the fact that there are 10 different protected identity groups in the law, the fact that one identity group, one portion of one identity group, the religious identity group, compromised up 52% of it, that's a large piece. If you look at all my cases this year against the Jewish community, about 80% of them involve the drawing of a swastika. Now, earlier today, I didn't speak at the press conference I was at with them earlier, but one rabbi spoke about, thankfully it's only graffiti. Thankfully it's only criminal mischief. The incident in Staten Island, somebody spray painted.
Rabbi Katzman.
Sorry? Rabbi Katzman. I don't know if he's the one who said it, but it was Rabbi Katzman's facility, yes. Somebody spray painted Synagogue of Satan on the wall, and they wrote SOS on another wall. But he said, thank God it's only criminal mischief. Thank God it's only property damage. When I got into this unit a little over 2 years ago, that's the first presentation I gave. I said, we don't use the word only in the hate crime task force. There's no such thing as only criminal mischief. That to me is no better than an assault, a robbery, a major incident. They're all the same. Hate crimes are hate crimes. So just to tell you a little about what we do. It's a citywide unit. We try out the Lower East Side of the 7th Precinct. There's 25 people in the unit, including myself. I have right now about 19 investigators because I picked up 2 more yesterday. People say that's not enough. 19 investigators in a city of 8.6 million people, 368 crimes last year, that's not enough. If you break down that math, my detectives are handling about 1.5 cases a month. If you're dealing with a precinct detective squad because of robbery, a car broken into, or any other issue like that, you're dealing with a detective who handles probably 200 cases a year. Mine handled 20. Because of that, these guys are focused on exactly what they're doing. They have plenty of time to work that case to completion. A little about the Hate Crime Task Force. December 31st of next year will be the 40th anniversary of the creation of a hate crime unit in New York City. It used to be called the Bias Incident Investigation Unit when it started. Sometime in the late 90s it switched over to be called the Hate Crime Unit. We are the largest dedicated hate crime unit in the world, in the country. And we are the second oldest, because no matter how good the Yankees are doing right now, Boston still beat us to get the first hate crime unit. They had the first one before us, but we're still the largest. There are 18,000 law enforcement agencies in this country. 18,000. Somewhere between 6 and 8 of them, roundabout, have dedicated hate crime units. 6 or 8 out of 18,000 have a unit that just does hate crimes. Everybody investigates hate crimes, every municipality does it, but it's lumped in with elder crime, or special victims, or some sort of major case unit. Ours are just the investigation of hate crimes. The Twitter police aren't coming to investigate your crime. Take a picture and put it on Twitter and say how horrible this is. The Twitter police are not showing up, neither are the Facebook agents. Call the police. Call 911. And somebody asked me to mention, site security. I know that was one of the original topics you guys mentioned. All I'll touch on is cameras. If you have cameras on your business, on your residence, on your synagogue, on wherever, make sure they work. Make sure they're recording. Make sure they point in the right direction. Make sure people know how to use it and access it. And make sure the time and date are correct.